of human pregnancy, and neither should Congress, unquote. This legislation is an extreme and mean-spirited way to roll back women's health and rights. It is too extreme for women, too extreme for America, and we must reject it. Thank you. I yield back.
The gentleman reserves. The gentleman from Pennsylvania.
Madam Speaker, at this time I am pleased to yield 2 minutes to one of the outstanding pro-life leaders in this House, a pro-life Democrat, my co-sponsor of Protect Life Act, gentleman from Illinois, Dan Lipinski.
The gentleman from Illinois is recognized for 2 minutes.
I thank the gentleman for yielding and for his leadership on this issue. Madam Speaker, I rise today in strong support of the Protect Life Act, a bill which will apply the decades-old Hyde Amendment policy prohibiting taxpayer funding of elective abortion to the Affordable Care Act. While the discussion in our nation continues concerning laws governing abortion, there's been a general consensus to prohibit the use of taxpayer money to pay for elective abortion or insurance coverage of abortion. This has long been embodied in the Hyde Amendment that annually has been included in an appropriations bill which most of us on both sides of the aisle have voted for. The Protect Life Act simply applies the Hyde Amendment to the Affordable Care Act, just as the House did in 2009 with the Stupak-Pitts Amendment during our initial consideration of the Affordable Care Act. At that time, 63 of my Democratic colleagues joined me in voting for that amendment. However, the final bill that became law did not include that language, and the President's executive order does not implement the Hyde Amendment. The order does not include Hyde prohibitions on taxpayer funding for insurance coverage of abortion, and it can be struck down by courts or overturned by any administration at any time. In addition, what happened last year with state high-risk health plans covering abortion demonstrates the vulnerability that the executive order has and the need for clarity. Madam Speaker, today we have the opportunity to provide that clarity and do what a large majority of Americans want and what Congress has done for more than 3 decades. That is, prohibit the use of taxpayer dollars for abortion. So today I urge my colleagues to support the Protect Life Act, and I yield back the balance of my time.
The gentleman reserves. The gentleman from New Jersey.
Madam Speaker, let me just ask about the time again. I have 2 more speakers.
The gentleman from New Jersey has 6 minutes. The gentleman from Pennsylvania has 7.
I have 2 more speakers. Would you, do you have more than that?
Madam Speaker, this time I yield 1 minute. Gentleman from New Mexico, Steve Pierce.
The gentleman from New Mexico is recognized for 1 minute.
Thank you, Madam Speaker, and thank you to the gentleman from Pennsylvania. In the United States, if you destroy an eagle egg, you're subject to 5 years in jail and a $250,000 fine. If you destroy a human egg, it's not only legal, but it's taxpayer funded. That's what we're here to talk about. You would hear our friends say that we've taken too much time today, that we can't give 2 hours out of the endless lunches, out of the fundraisers, out of the rubbing elbows with the powerful to talk for the unborn and the innocent. I would tell you that even in economic times, we cannot suspend our voices against injustice. We cannot suspend our voices for the weak, the powerless. It is our sacred duty to be a voice in the Republic for those who have no standing. The unborn have no standing and no voice. Let us allow our voices to be heard for these 2 hours.
The gentleman reserves. The gentleman from New Jersey.
Madam Speaker, I yield 2 minutes to the gentleman from New Jersey, Mr. Andrews.
The gentleman from New Jersey is recognized for 2 minutes.
Ask unanimous consent to revise and extend my remarks. Thank you, Madam Speaker. I thank my friend for yielding. What I'm hearing from the people in my area, I think most members are hearing this, is the American people want the divisiveness to stop and the jobs to start. This bill tonight does the opposite. It's the most divisive issue we could really put before this House and this country. There was a carefully balanced compromise that's been the law of the land and is the law of the land for a very long time, that says that taxpayer money should not pay for abortion, but that a woman who chooses to have an abortion with her own money has that right. This bill upsets that balance, but more importantly than that, I think this bill ignores the opportunity for us to come together and stop the divisiveness and start working on the problem the country wants us to work on, which is the creation of jobs. Tomorrow will be yet another Friday without a paycheck for millions of Americans. It might be the day that a small businessman or businesswoman closes their shop for the last time. It might be the day that the mortgage foreclosure is executed and someone loses their home. This country is in crisis. There is an emergency around this country that needs to be dealt with right now. People feel very, very deeply about the issue of abortion on both sides. I respect both sides. The law respects both sides with the compromise that we have. What we ought to collectively respect is the urgent demands of the American public to come together and get to work to put the country back to work. That should be the agenda of the Congress, not this bill. Let us work our will in whatever it is tonight. I'll be voting no. But can't we work our will on a plan to work together and put the country back to work? I yield back the balance of my time.
The gentleman reserves. The gentleman from Pennsylvania.
Madam Speaker, I yield 1 minute to the distinguished gentleman from Louisiana, Mr. Landry.
The gentleman from Louisiana is recognized for 1 minute.
Thank you, Madam Speaker. This is not a divisive issue. This is a bipartisan issue. The language in H.R. 358 was in the Stupak-Pitts amendment passed in the Democrat-led House last Congress. If they supported it then, why would they not support it now? Because of executive order? Absolutely not. Obamacare created a fund specifically reserved for abortion coverage. So what in the world makes one think this money will not support abortion coverage? We all remember we have to pass the bill before we find out what's in it. Unfortunately, they passed the bill and we found no language to ensure taxpayers won't have to pay for something the majority of Americans don't support. Madam Speaker, if my colleagues on the other side of the aisle insist that the health care law prohibits taxpayer funding for abortion, then they should support the bipartisan H.R. 358 to ensure that it is indeed the case. Thank you, and
the gentleman reserves. The gentleman from New Jersey.
Madam Speaker, yes, my colleague, I have one speaker left, and I know you get to close.
Madam Speaker, at this time I yield 1 minute. Gentleman from Kansas, Mr. Holzknecht.
The gentleman from Kansas is recognized for 1 minute.
I ask unanimous consent to revise and extend my remarks.
Without objection.
Madam Speaker, I rise today as a father of 4 adopted children to offer my strong support to the Protect Life Act. Opponents of this bill allege it is unconstitutional, and that is simply not true. While the Supreme Court has wrongfully decided abortion is a constitutional right, they have also clearly upheld the constitutionality of the Hyde Amendment and the language in this bill. Madam Speaker, this is not revolutionary, earth-shaking legislation we are considering. I would like to see Congress go much further in protecting life. We should not be funding abortions in the district. We should be protecting conscience rights for health care providers. We should stop giving money to organizations like Planned Parenthood. We should be ending the practice of abortion in America. This bill is an important step, but more certainly needs to be done. I urge my colleagues to protect life and support this bill. In honor of all adopted children, their birth families, and their adopted families, I yield back my time.
The gentleman reserves. The gentleman from Pennsylvania is recognized.
Madam Speaker, at this time I yield 1 minute to the distinguished chairman of the Pro-Life Caucus, Mr. Smith, the gentleman from New Jersey.
The gentleman from New Jersey is recognized for 1 minute.
Thank you very much, I said to my friend. Madam Chair, abortion not only dismembers and chemically poisons unborn children to death, and my friend from New Jersey, Mr. Pallone, used to know that. He used to be very pro-life, as some other members who have reversed themselves. But it also hurts women's health and puts future children subsequently born to women who aborted at significant risk. At least 102 studies show significant psychological harm, major depression, and elevated suicide risk in women who abort. Published just last month in the British Journal of Psychiatry, a meta-analysis comprised of 22 studies and over 887,000 participants, the largest quantitative estimate of mental health risks associated with abortion in world literature ever, revealed that women who have undergone an abortion experience an 81% increased risk of mental health problems. You never hear that from the abortion side. The Times of London have also found the clear link that women had twice the level of psychological problems and 3 times the level of depression. Subsequent risk to children born to women who have had a previous abortion. Is there any further time? Or no? No time. Yes, I'm just going to revise and extend. This is all about no taxpayer funding for abortion and
Without
conscience rights.
objection. The gentleman from New Jersey.
And Madam Speaker, is the gentleman prepared to close, or
We have 2.
additional speakers? I reserve.
The gentleman from Pennsylvania.
This time I yield 1 minute. The gentleman from Alabama, Mr. Adderholt.
The gentleman from Alabama is recognized for 1 minute.
Thank you, Madam Speaker. And I rise today, of course, in strong support of this legislation, the Protect Life Act. And I do want to thank the gentleman from Pennsylvania, Mr. Pitts, and the gentleman from Illinois, Mr. Lipinski, for this bipartisan legislation. We have heard during this debate the health care legislation was signed into law back in 2010. It simply did not protect the unborn. It in no way included clear or direct provisions that would prohibit federal funding of abortion. And the President's executive order on this issue is totally inadequate. Executive orders can simply be rescinded at any time and cannot be relied upon to clarify such an issue at any time. There is some people that has said the legislation that's before us today will stop women from buying health insurance coverage that includes abortion, even if they want to from their own money. According to the bill that's before us, the bill sets out and articulates that individuals may purchase plans that cover abortion with their own money. On top of that, the bill also allows a supplemental abortion policy for those who use a government subsidy to buy insurance. So I wanted to point that out to my colleagues here this evening, and I would ask for support for this legislation. I yield back.
The gentleman reserves his time. The gentleman from New Jersey.
Gentleman is prepared to close. I would yield the balance of my time to the gentlewoman from Colorado, who's really the most knowledgeable on this issue.
The gentlewoman from Colorado is recognized for 4 minutes.
Thank you, Madam Speaker. Madam Speaker, there are some days in this Congress I feel like I'm in Alice in Wonderland, where logic is turned on its head and all of us have fallen down the rabbit hole. Today is certainly one of those days. Here we stand on the 282nd day of this Congress, and the House majority has not yet passed a jobs plan. Instead, we have spent all day long once again attacking women's health with a bill that will never become law. A similar bill already passed the House and died in the Senate. And the President has issued a veto threat on this bill, even if it did somehow become law. Now, Madam Speaker, with only 20 legislative days left this year, the leadership of this body has somehow decided that we should spend the day advancing legislation which would severely compromise women's health. Madam Speaker, despite the claims from my colleagues across the aisle, this bill does not simply say that there won't be any public funds for abortion. It goes far, far beyond. In fact, the Hyde Amendment, which is the law of the land, says that there will be no federal funds for abortions except in cases of rape, incest, or the life of the woman, period. Let me say that again. There is no federal funding of abortion anywhere in federal law. Let me say that again. The federal law, not the federal employees' health care plan, not Medicaid, not the military, not the Affordable Health Care Act. I will not yield. Nowhere in the law is there federal funding for abortion, period. In the Affordable Health Care Act, in Section 1303, it specifically says there will be no federal funding for abortion. Now, this bill, contrary to the claims of its proponents, goes far beyond current law, and here's how. It says women who purchase health care insurance in the exchanges cannot use their own money to buy private insurance plans that have a full range of reproductive coverage. Under current law, women can use their own money to buy insurance that covers that full range of reproductive health care. And, Madam Speaker, that is not changed by the Affordable Health Care Act. But under this law, what would happen would be women purchasing private insurance plans in the exchanges with their own private money would not be able to purchase a plan that had a full range of reproductive care. That would take away the rights of women to exercise their own constitutional rights to have a full range of health care. In addition, Madam Speaker, this bill also includes such broad refusal language it could override core patient protections contained in the Emergency Medical Treatment and Active Labor Act, allowing hospitals to refuse life-saving treatment to women on religious or moral grounds, thus causing their death inside the hospital despite their treatable condition. Now listen, when I listen to this debate, it's really clear to me that the proponents of this bill, their main concern is not federal funding of abortion. Their main concern is they want abortion to be illegal. And so here's my view. Having debated this now for 15 years in this body, here's my view. If the majority wants to pass a bill banning abortion, pass a bill banning abortion, and we'll fight it out in the courts. Don't make claims that there's somehow federal funding for abortion when, in fact, there is none, to confuse the issues and to try to confuse the American public. Because I'm going to tell you something. The public will not be confused. They know what this bill does. They know they want jobs, and they know that's our agenda. Vote no on this ill-conceived piece of legislation.
The gentleman from Pennsylvania.
Madam Speaker, I yield the balance of my time to the gentleman from Texas, Dr. Burgess, to close.
The gentleman from Texas is recognized for 2 minutes.
And I thank the gentleman for the recognition. Let's be clear about the Affordable Care Act. The EMTALA provision in the underlying law, the Affordable Care Act, is not actually the EMTALA provision because it puts in a great big loophole. The loophole was in the language of the law, and it said providing emergency services as required by state or federal law, which may be changed, and therein is the problem. Most of us remember the night before the Affordable Care Act passed. We remember the drama of Bart Stupak going down to the White House. We remember the drama of the executive order. So what Mr. Pitts is providing us today is the ability to put the language of the executive order into legislative language and make it law so that it may not be arbitrarily changed by this president or some other president at a future time. Now, I want to take just a few moments and read into the record from doctors who've written to our committee, doctors who provide emergency services, obstetric services, who tell us over and over again that they have never been required to do something that was against their conscience and put someone's life in danger. A doctor from the University of Minnesota writes in, during my years of practice, I have worked under informal and formal conscience rights protections that permit me to provide the best pregnancy care without being forced to perform abortions. In my years of practice, I have never seen a woman denied appropriate care because of the exercise of the rights of conscience in this regard. Another letter from Virginia Hospital. As a physician who has worked in emergency rooms for over 30 years, I am well versed in the Federal Emergency Medical Treatment and Active Labor Act and similar policies. I continue to practice emergency medicine. I teach it Based on 3 decades of experience, I see absolutely no merit in the claim that conscious laws on abortion pose any risk of allowing pregnant women to die in emergency rooms. Another letter from the University of North Carolina. My personal conscience directs me to provide the best of care to pregnant women and their unborn children, and I am able to do so without performing abortions, as are several of my colleagues and a proportion of the residents we train each year. I have not seen a situation where an emergent event or urgent abortion was needed. No one in my entire 20 years of clinical practice has ever been denied appropriate care because of the exercise of my rights of conscience. Our committee is receiving these letters all of the time. I submit them for the record, and I urge an aye vote on the Pitts bill.
All the time for debate on the bill has expired. Pursuant to House Resolution 430, the previous question is ordered on the bill as amended. The question is on the engrossment and third reading of the bill. Those in favor say aye. Opposed, no. What? Have it. Third reading.
A bill to amend the Patient Protection and Affordable Care Act to modify special rules relating to coverage of abortion services under such act.
For what purpose does the gentlewoman from California seek recognition?
I have a motion to recommit at the desk.
Is the gentlewoman opposed to the bill?
I am.
The gentlewoman qualifies. The clerk will report the motion.
Mrs. Capps of California moves to recommit the bill, H.R. 358, to the Committee on Energy and Commerce with instructions to report the same to the House forthwith with the following amendment. In Section 2A7 in the amendment instruction adding the new subsection G, strike subsection and insert subsections. Insert after the subsection G of Section 1303 of the Patient Protection and Affordable Care Act as proposed to be added by Section 2A7 the following. H. Protecting the life of the mother in a medical emergency. Nothing in this act shall be construed to exempt any hospital or healthcare provider from federal or state laws that require such hospital or provider to provide medical examination, treatment, referral, or transfer to prevent the death of a pregnant woman with an emergency medical condition.
The gentlewoman is recognized for 5 minutes.
Madam Speaker, as the debate today has shown, this chamber is deeply divided over this bill. But we should all be able to agree that when a pregnant woman is in a medical emergency, we must do all we can to save her. And that is what this final amendment affirms. Now, I want to be clear. The passage of this amendment will not prevent the passage of the underlying bill. If it's adopted, my amendment will be incorporated into the bill, and the bill will immediately be voted upon. Madam Speaker, the underlying bill creates a loophole which would allow hospitals to circumvent the Emergency Medical Treatment and Active Labor Act, a law that has saved many lives. The law, called EMTALA for short, was established to ensure that when a patient arrives at a hospital in a critical condition, particularly women in labor, the patient will at least be stabilized. It is truly the embodiment of the Hippocratic Oath to, and I quote, apply for the benefit of the sick all measures that are required, end quote. EMTALA has been law for over 25 years, and it works. However, the bill before us today could lead to a radical and uncalled-for loophole to this law. It would allow providers to refuse emergency care for women even if their lives are endangered by their pregnancy. The hospital could even refuse to give a referral. Now, I'm a nurse who's worked long shifts in the hospital setting, and I find it immoral to deny care to a woman with a life-threatening condition just because she's pregnant. This loophole is wrong, it's extreme, and it's cruel. Unfortunately, there are some tragic complications that can occur during pregnancy for which a therapeutic abortion is necessary to save the life of a pregnant woman. I'm speaking about conditions like severe preeclampsia, where a pregnant woman's rapid rise in blood pressure can lead to seizure, stroke, multiple organ failure, and her death. Or pulmonary hypertension, a condition that American College of Cardiology guidelines explicitly states necessitates the termination of a pregnancy to avoid maternal death. If you've never heard of these conditions, it might be easy to think they're not significant issues. But to the women whose lives are saved by these emergency abortion services, oftentimes mothers who very much want this pregnancy to be successful, this issue is more than politics. It's literally life or death. What if your wife, your daughter, was rushed to the hospital pregnant with severe bleeding. You don't research or compare the policies of your local hospitals. You go to the one that's closest. The one you trust will save your loved one. But when the diagnosis is made and an emergency abortion is necessary to save her life, what would you do if that hospital refused to perform it, to stabilize her, or even provide a referral for her care elsewhere? Thanks to the protections provided by EMTALA, this cannot happen today. But if this bill before us becomes law without my amendment, it very well could. Madam Speaker, my amendment is not just a debate between two sides of the abortion issue. It is about saving women's lives in the middle of very traumatic times for them and their families. So I'd like to bring to your attention a letter sent to Chairman Pitts from the Catholic Health Association. CHA is clear in its religious affiliation and its opposition to abortion. So perhaps because of this perspective, CHA says it's best, and I quote, CHA member hospitals have been providing compassionate quality care under both EMTALA and the Weldon Amendment without conflict since the enactment of these provisions. Accordingly, the Catholic Health Association does not believe that there is a need for the provider non-discrimination section to apply to EMTALA, end quote. CH's statement is clear. EMTALA's treatment requirements and the current provider conscience clause work together hand in hand. There is no need for an unprecedented carve-out or exception that would endanger women's lives. As a nurse, I respect the conscience clause language a great deal, but I cannot ever imagine a situation where morally, ethically, and legally a medical professional could be allowed to stand by and let someone needlessly die. No pregnant woman or her family should be afraid that she would be denied the care she needs when she goes to a hospital in an emergency. And we need to make sure that doesn't happen. Today we have the opportunity to fix a problem created with this legislation before tragedy strikes. So I urge you to protect women's lives and support this final amendment to this bill. And I yield back the balance of my time.
The gentlelady's time has expired. The gentleman from Pennsylvania is recognized for...
Madam Speaker, I claim time in opposition to the motion.
The gentleman is recognized for 5 minutes.
Madam Speaker, a vast majority of Americans, regardless of whether they support or oppose abortion being legal, believe that the federal government should not be subsidizing abortions. Some on the other side are bringing up a red herring in an attempt to continue to allow federal funding of abortion. To dispel the myths being disseminated by opponents of H.R. 358, every member should understand that this bill would not change the Hyde Amendment, the EMTALA statute, or the standard of care required of providers under the EMTALA law. Section 1867E of the Social Security Act, commonly known as EMTALA, calls on emergency personnel to respond to distress on the part of a pregnant woman or her unborn child by stabilizing the condition of both mother and the unborn child. It is ironic that opponents of H.R. 358 claim it will establish an objectionable standard of care when that balanced standard has long been recognized under EMTALA. My colleagues, the question before us today is simple. If you favor federally funded abortion coverage, then you should support the motion to recommit and oppose the bill. If you believe, like a majority of Americans, that the federal government should not be subsidizing abortion, then you should oppose the motion to recommit and support H.R. 358. Vote no on the motion to recommit. Vote yes on this critical legislation, and I yield back.
The gentleman yields back. Without objection, the previous question is ordered on the motion to recommit. The question is on the motion. All those in favor say aye. Those opposed, no. The noes have it. The motion is not agreed to.
Madam Speaker, I ask for
the gentleman from California.
Madam Speaker, I asked for the yeas and nays, please.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas and nays are ordered. Members will record their votes by electronic device. Pursuant to Clause 9 of Rule 20, the Chair will reduce to 5 minutes the minimum time for any electronic vote on the question of passage. This will be a 15-minute vote.
A procedural vote here in the House, the last chance to change the bill that would allow no federal funds to be used for health insurance plans that offer abortion services. We asked a Capitol Hill reporter why this bill is coming up now.
Why are House Republicans bringing up this bill dealing with state health insurance exchanges and abortions?
Well, part of the reason is that this is a part of their Pledge to America that they made last year during the campaign for the 2010 midterm elections. They promised to bring up several measures that address federal funding and prohibiting federal funding from being used for abortion, and they're following through.
And why are supporters saying the bill is necessary?
Part of the reason that they're arguing that the bill is necessary is as part of the health care reform law signed into law by President Obama last year, there was a delicate compromise on federal funding. Some anti-abortion Democrats had demanded that that the law be written in a way so that federal funds wouldn't be used directly for any kind of abortion services. They didn't reopen the legislation during debate, but what happened as part of the compromise was that President Obama signed an executive order, and what proponents of the legislation are arguing is that it's necessary to put this into law because an executive order doesn't have the same force of law.
Who is opposed to this measure, and what are their points against it?
Most abortion rights legislators or lawmakers are pretty vehemently opposed to this. That makes up a fairly significant chunk of the Democratic caucus, as you'll see a fairly partisan vote on this. What they're arguing is that this effectively takes away an important chunk of women's health coverage from the insurance exchanges, because right now the way that the health care law is written, a woman can elect to have a health care plan that does provide abortion services as long as the money is segregated and there is money that goes from a pot that doesn't include any federal funds for abortion. This would effectively take away that option because it would prohibit any insurance exchange plan from receiving federal funds if they offer any abortion services at all. So the abortion rights lawmakers and proponents of abortion rights are arguing that this is one way of chipping away at a woman's right to choose.
What are the bill's prospects in the House today?
It looks like it will pass. It'll probably pass with I wouldn't say a comfortable margin, but certainly more. They won't have to hold open any votes, I don't think, to whip in order to get to 218. Whether it goes up to 230, 240, 250 is something to be seen, but right now the Democratic leadership is not whipping against the bill because they don't see that it has any chance of getting a vote in the Senate or being signed into law, so they're not actively whipping against it. So some Democrats have sort of a free vote on this one.
What other abortion-related bills are House Republicans contemplating bringing up for votes?
Well, right. This one sort of came, I wouldn't say out of thin air, but it certainly came out a little unexpectedly. Right now, I mean, in the spring, the House passed a few abortion-related bills, including one by Representative Chris Smith that still haven't received any kind of attention in the Senate. So right now, it's unclear what might be on the horizon.
And tell us again about the Senate. How is today's bill and some of the others that are coming up? How are they expected to fare?
It's unlikely that this bill would even receive any kind of floor attention unless, of course, it comes up as some sort of amendment. The legislative clock is getting pretty sparse, or the calendar is getting pretty packed, and there's not a whole lot of time left in the calendar year or the legislative year. So it's unlikely that it would come up in the Senate at all. And even if it were to come up in the Senate, it's not likely to pass. And even if in the unlikely event that it would pass, President Obama yesterday said that he would veto the legislation.
Jason Dick is the House editor at Roll Call. We thank you for joining us.
Thank you very much.
We'll hear more about that bill on health care coverage of abortions in a minute. First, I wanted to tell you that we have live coverage right now of the guest arrivals for the White House State Dinner for South Korean President Lee Myung-bak. We'll also have the toast live. You can see that on C-SPAN 2 and cspan.org right now. The House this afternoon held a joint meeting with the Senate to hear from President Lee. We also covered his arrival at the White House today and President Lee's press conference this afternoon with President Obama. We'll have all of the day's coverage of President Lee's visit in our overnight programming here on C-SPAN. You can also see all of that at cspan.org. Up next here in the House, a vote on final passage of the bill that would allow no federal funds to be used for health insurance plans that offer abortion services. Here's debate on that bill from earlier today.
The Protect Life Act, authored by Chairman Joe Pitts and Dan Lipinski, ensures that all the elements of the Hyde Amendment applies to all the programs that are authorized and appropriated in Obamacare. By now, I trust that all members fully understand that because programs in Obamacare are both authorized and appropriated in the law on a parallel track, not subject to appropriations under HHS, the actual Hyde Amendment therefore has no legal effect whatsoever. Hyde only affects labor HHS programs, not the massive expansion of government-funded health care. Thus, Obamacare, when phased in fully in 2014, will open up the floodgates of public funding for abortion in a myriad of programs, including and especially in the exchanges, resulting in more dead babies and wounded mothers than would otherwise have been the case. Because abortion methods dismember, decapitate, crush, poison, or starve to death, or induce premature labor, pro-life members of Congress, and according to every reputable poll, majorities of Americans want no complicity whatsoever in the destruction of human life. Obamacare forces us to be complicit. Despite breathtaking advances in recent years in respecting and treating unborn children as patients in need of diagnosis and care and treatment for any number of diseases, just like any other patient, far too many people dismiss the baby in the womb as persona non grata. I respectfully submit, how can violence against children by abortion be construed as benign or compassionate or caring? The dangerous myth of safe abortion must be exposed. So-called safe abortion is the ultimate oxymoron, an Orwellian manipulation of language designed to convey bogus respectability to a lethal act. Abortion is, by any reasonable definition, child mortality. Its sole purpose is to kill a baby. I would also suggest that presumptuous talk that brands any child as unwanted or an unwanted child reduces that child to a mere object bereft of inherent dignity or value. We should not be paying for abortion. I support the Pitts Amendment.
The gentleman's time has expired. Gentleman from Florida.
Thank you very much, Madam Speaker. The Protect Life Act amends the Patient Protection and Affordable Care Act to prohibit federal funds from being used to pay for abortion services or any health plan that includes such service. It also imposes new restrictions on health insurance coverage for termination care and expands conscience protection laws while limiting access to reproductive health services. At a time when our nation is facing great economic uncertainty and millions of Americans are in need of jobs, please somebody tell me why we are here considering a bill that is a direct attack on a woman's constitutionally protected right to choose and that does not create one single job. Let's be serious here. Republicans have yet to pass a jobs bill. Instead of getting down to the business of creating jobs, they're bringing to the House floor a deeply flawed and deeply divisive bill that will not pass the Senate and would be vetoed if it reached the President's desk. They know that, I know that, everybody knows that. The Protect Life Act is both unnecessary and clearly is politically motivated. Republicans are resorting to their old bag of tricks and pulling the abortion card in order to distract from their clear lack of leadership. In April, they rammed through H.R. 3, the No Taxpayer Funded for Abortion Act. Instead of focusing on efforts to pass a clean, continuing resolution that would prevent a government shutdown. As the deadline approaches for the Joint Select Committee on Deficit Reduction in Congress to approve a deficit reduction plan in excess of $1.5 trillion, Republicans have deemed it necessary to rehash the health care reform debate and roll back women's rights. And I want to clear up one thing. They keep saying Obamacare. I've said repeatedly that there are those of us, and I am among them, that advocated for health care, including a public option and universal health care, long before we even knew Barack Obama's name. So perhaps it should be called Hastings/Obamacare. This time, however, they take it to a new harmful extreme. The Protect Life Act is not about the regulation of federal funds with regard to abortion services. The Hyde Amendment already does that. This act is about restricting access to care and intimidating women and their families in the use of their own money. Since 1976, the Hyde Amendment has prohibited the use of taxpayer money for funding abortions unless the abortion is performed in the case of rape, incest, or threat to the life of the mother. The Affordable Care Act is no exception. Regardless of the facts, however, House Republicans continue their assault on a woman's right to choose. Contrary to popular belief, the Protect Life Act is not the Stupak-Pitts amendment of the 2009-2010 health care reform debate. It goes far beyond Stupak-Pitts to impose unprecedented limitations on abortion coverage and restricts access to abortion services for all women. The Protect Life Act would have an adverse effect on women's access to reproductive services, especially for low-income minority women who are very likely to be underinsured or uninsured and use partial subsidies to purchase insurance. It not only ends abortion coverage for women in the exchange who use their own private funds to pay for their insurance, but also essentially shuts down the private insurance market for abortion coverage. This act imposes crippling administrative burdens on insurance companies that choose to cover abortion care and bans abortion coverage from all multi-state plans, interfering with private insurance companies' decisions about what benefits to offer. Simply put, the Protect Life Act is a misnomer. It poses a direct threat to the health and lives of women by restricting access to termination services, including factually accurate information, such as the availability and coverage of abortion care by insurance plans. Even more troubling is the fact that this act creates an exception to the obligation of hospitals to comply with the Emergency Medical Treatment and Labor Act, which requires appropriate treatment and referral for emergency patients. If enacted, hospitals could refuse to provide abortion services to pregnant women whose lives are in critical danger. This is beyond irresponsible. It is, indeed, reprehensible. Finally, the Protect Life Act vastly broadens already expansive federal conscience laws without regard for patient protection or anti-discrimination protection for providers of abortion services. It safeguards from federal preemption state conscience laws beyond abortion, which could allow providers to drop their coverage of other reproductive health services like contraception and possibly even reproductive care such as mental health services and HIV counseling. All I hear from my colleagues on the other side of the aisle, especially those within segments of their party, is that they want the government to butt out. Why then are we considering legislation on the House floor that effectively overturns the privacy rights enumerated by the United States Supreme Court, as well as increases burdensome government regulations on insurance companies? Congress should not be making personal health care decisions for women. and congressmen really shouldn't be even involved in making personal health care decisions for women. That should be between a woman, her family, and her doctor. I reserve the balance of my time.
Gentleman reserves the balance of his time. The gentlewoman from North Carolina.
Thank you, Madam Speaker. I now would like to yield 2 minutes to the distinguished chairwoman of the Foreign Affairs Committee, Ms. Ross-Lehtinen.
Gentlewoman from Florida is recognized for 2 minutes.
I thank the Speaker, and I thank my good friend for yielding me the time. I stand in strong support for the Protect Life Act. I thank my good friend, my colleague, Congressman Pitts, for introducing this important legislation, because this bill will help ensure that no funds authorized or appropriated by the President's health care law will be used to pay for abortion, except in the cases of rape, incest, or to save the life of the mother. This is not something new. This is not something radical. This simply applies the bipartisan principles of the Hyde Amendment, which has helped guide this chamber's legislative deliberations for over 3 decades. It sets the same standards applied to Medicaid, the Federal Employees Health Benefits Program, and other federal programs. The American people, Madam Speaker, have made it quite clear that they do not want their taxpayer dollars used to fund abortions. And the Stupak-Pitts Amendment, as we know, it was gutted in the Senate. The President's executive order stating that the Hyde Amendment would apply is not enough. Why? It is flawed because executive orders can disappear as quickly as they are issued. But the Protect Life Act will create a solid framework that will safeguard taxpayer dollars. We must protect the sanctity of an innocent human life. We must stand behind the rights of the unborn, and we must prevent taxpayer dollars from being used to fund abortions. And that's why I'm proud to support the Protect Life Act and the rule for it. I thank the gentlelady for the time, and I yield back.
Gentlewoman yields back. The gentleman from Florida.
Madam Speaker, would you be so kind as to tell me how much time
Certainly.
remains on each side?
Gentleman from Florida has 23 minutes remaining. The gentlewoman from North Carolina has 26 and a half.
Madam Speaker, with your permission at this time, I'm going to yield to a number of members for unanimous consent, the first of whom, the gentleman from Illinois, Mr. Quigley.
Without objection.
Madam Speaker, I ask unanimous consent to revise and extend my remarks in opposition to this bill because it is an assault on a woman's health and her right to make her own life decisions.
Without objection.
Oh, yeah. I yield for unanimous consent request Ms. Velasquez from New York.
Gentlewoman's recognized.
Thank you, Madam Speaker. I ask unanimous consent to revise and extend my remarks in opposition to this bill because this extreme legislation is dangerous to women's
Madam
health
Speaker.
and does nothing to address the main issue affecting American families in this country, the lack of jobs.
Will the gentlewoman...
Madam Speaker, parliamentary inquiry.
Gentlewoman from North Carolina.
Madam Speaker, is it appropriate for our colleagues across the aisle to make comments about the bill when they're asking unanimous consent?
The Chair would advise members to confine their unanimous consent requests to a simple declarative statement of the member's attitude toward the message, either aye or no. Further embellishments will result in continued deductions of time from the gentleman from Florida.
Madam Speaker, further parliamentary inquiry.
Gentleman from Florida.
That declarative statement that you speak to, am I correct, Madam Speaker, that it could include a sentence?
No.
A simple declarative statement is acceptable. An embellishment because da-da-da-da-da would be an embellishment. Thank you very much.
At this time, I yield for non-embellishment to the distinguished lady from New York, Ms. Hahn, for
California,
unanimous consent.
From California.
From California, yes, I'm sorry.
I ask unanimous consent to revise and extend my remarks in opposition to this bill because Americans need us to focus on jobs right now, not this extreme bill that endangers the lives of women.
What? Without objection, the Chair will begin deducting time.
No problem. I yield unanimous consent to the distinguished lady from California, Ms.
Madam
Wilson.
Speaker, I ask unanimous consent to revise and extend my remarks in opposition of this bill that is extreme
dangerous legislation.
Without objection.
Madam Speaker, I yield to the distinguished lady, former member of the Rules Committee, Ms. Matsui, for unanimous consent.
Without objection.
Madam Speaker, I ask unanimous consent to revise and extend my remarks in opposition to this bill because its extreme legislation is dangerous to women's health and does nothing to address the jobs crisis facing Americans today.
Without objection, the gentleman will be charged.
Madam Speaker, at this time I'm very pleased to yield to the distinguished gentleman from the state of Washington, Mr. McDermott, for unanimous consent.
Without objection.
Madam Speaker, I ask unanimous consent to revise and extend my remarks in opposition to this bill because it is an attack on women and it does nothing to deal with the job crisis of this country.
Without objection, the gentleman will be charged.
Madam Speaker, I yield to the distinguished lady from Wisconsin, Ms. Moore, for unanimous consent.
Without objection.
Madam Speaker, I ask unanimous consent to revise and extend my remark in strident opposition to this bill. I yield back.
Without objection.
Madam Speaker, I reserve the balance of my time.
The gentleman reserves the balance of his time. The gentlewoman from North Carolina.
Thank you, Madam Speaker. I now yield 2 minutes to the distinguished gentleman from Texas, Mr. Brady.
Gentleman from Texas will be recognized for 2 minutes.
Thank you, Madam Speaker. As a co-sponsor and the proud parent of 2 young boys, adopted young boys, whose family exists only because 2 women in 2 difficult situations in 2 different states chose life and gave us a family. I am proud to rise in strong support of the rule to allow the House to consider the Protect Life Act led by my friend and colleague, Congressman Joe Pitts. Over a year ago, President Obama and the health care plan was signed into law despite a strenuous outcry by the American people without significant and substantial prohibitions on federal funding for abortion. This funding of abortion through insurance plans, community health centers, and other programs created by the new health care law could have been avoided, but such language was intentionally left out. There have been restrictions on abortions and subsidies for over 30 years, beginning with the Hyde Amendment in 1976, and I'm proud that today we are acting in that spirit. Regardless of whether you are pro-choice or, like me, strongly pro-life, Americans have always agreed we will not use federal tax dollars to subsidize or incentivize abortion. And you don't have to take my word for it. In poll after poll, more than 60% of Americans oppose using federal funding for abortions. And more recently, 2/3 of Americans said we shouldn't subsidize health insurance that includes abortions. The President's health care plan fails to provide real conscious protection for health care providers who decline to participate in abortions by mandating that they not be discriminated against because of their religious faith. The bottom line is this bill we take up today strikes an important balance. It makes sure your federal tax dollars are not used to subsidize abortions in the President's plan, and we make sure that people and institutions are able to care for their patients and are not forced to violate their moral principles. I strongly urge my colleagues to respect America's conscientious objections to abortions by voting for the rule and for the Protect Life Act.
On this vote, the yeas are 173. So the nays are 249. The motion is not adopted. The question is on passage of the bill. All those in favor say aye. Those opposed, no. In the opinion of the chairs, the ayes have it.
Speaker, Madam Speaker.
For what purpose does the gentleman from Virginia rise?
On that matter, Madam Speaker, I request the yeas and nays.
A recorded vote is requested. Those favoring a recorded vote will rise. A sufficient number having risen, a recording vote is ordered. Members will record their votes by electronic device. This is a 5-minute vote.
A vote on final passage of a bill that would allow no federal funds to be used for health insurance plans that offer abortion services. In contrast, current law says that health plans receiving federal funds must keep federal funds segregated from any funds for abortion services. We asked a Capitol Hill reporter why this bill is coming up now.
Why are House Republicans bringing up this bill dealing with state health insurance exchanges and abortions?
Well, part of the reason is that this is a part of their Pledge to America that they made last year during the campaign for the 2010 midterm elections. They promised to bring up several measures that address federal funding and prohibiting federal funding from being used for abortion, and they're following through.
And why are supporters saying the bill is necessary?
Part of the reason that they're arguing that the bill is necessary is as part of the health care reform law signed into law by President Obama last year, there was a delicate compromise on federal funding. Some anti-abortion Democrats had demanded that that the law be written in a way so that federal funds wouldn't be used directly for any kind of abortion services. They didn't reopen the legislation during debate, but what happened as part of the compromise was that President Obama signed an executive order, and what proponents of the legislation are arguing is that it's necessary to put this into law because an executive order doesn't have the same force of law.
Who is opposed to this measure, and what are their points against it?
Most abortion rights legislators or lawmakers are pretty vehemently opposed to this. That makes up a fairly significant chunk of the Democratic caucus, as you'll see a fairly partisan vote on this. What they're arguing is that this effectively takes away an important chunk of women's health coverage from the insurance exchanges, because right now the way that the health care law is written, a woman can elect to have a health care plan that does provide abortion services as long as the money is segregated and there is money that goes from a pot that doesn't include any federal funds for abortion. This would effectively take away that option because it would prohibit any insurance exchange plan from receiving federal funds if they offer any abortion services at all. So the abortion rights lawmakers and proponents of abortion rights are arguing that this is one way of chipping away at a woman's right to choose.
What are the bill's prospects in the House today?
It looks like it will pass. That it'll probably pass with I wouldn't say a comfortable margin, but certainly more. They won't have to hold open any votes, I don't think, to whip in order to get to 218. Whether it goes up to 230, 240, 250 is something to be seen. But right now, the Democratic leadership is not whipping against the bill because they don't see that it has any chance of getting a vote in the Senate or being signed into law. So they're not actively whipping against it. So some Democrats have sort of a free vote on this one.
What other abortion-related bills are House Republicans contemplating bringing up for votes?
Well, right. This one sort of came, I wouldn't say out of thin air, but it certainly came out a little unexpectedly. Right now, I mean, in the spring, the House passed a few abortion-related bills, including one by Representative Chris Smith, that still haven't received any kind of attention in the Senate. So right now, it's unclear what might be on the horizon.
And tell us again about the Senate. How is today's bill and some of the others that are coming up? How are they expected to fare?
It's unlikely that this bill would even receive any kind of floor attention unless, of course, it comes up as some sort of amendment. The legislative clock is getting pretty sparse, or the calendar is getting pretty packed, and there's not a whole lot of time left in the calendar year or the legislative year. So it's unlikely that it would come up in the Senate at all. And even if it were to come up in the Senate, it's not likely to pass. And even if in the unlikely event that it would pass, President Obama yesterday said that he would veto the legislation.
Jason Dick is the House editor at Roll Call. We thank you for joining us.
Thank you very much.
Live coverage happening right now of the guest arrivals for the White House State Dinner for South Korean President Lee Myung-bak. That's happening on C-SPAN 2 and cspan.org. Wanted to mention that the Senate today confirmed the nomination of Sung Kim to be the next U.S. ambassador to South Korea. 2 more votes after this one in the House.
This vote, the yeas are 251 and the nays are 172. The bill is passed. Without objection, a motion to reconsider is laid on the table. Pursuant to Clause 1C of Rule 19, further consideration of H.R. 2250 will now resume. The clerk will report the title.
Union Calendar number 1.